When can I return to sport after a hip flexor strain? If you have experienced a hip flexor strain, you might be wondering when you can safely return to your sport. The answer depends on how severe your injury is. Hip flexor strains are classified into 3 grades, and each grade has its own recovery timeline. For a grade I strain, which is mild, you are looking at minor overstretching or small tears in the muscle. Most athletes can start a tailored rehabilitation program within about 2 weeks. Gentle stretching and light activities can begin early on. A full return to your sport may be possible within 1 to 3 weeks. If your injury is a grade Roman II strain, which is moderate, this involves partial tears of the muscle. Recovery will take a bit longer and requires a structured rehabilitation program. You can usually resume light activities around 4 to 6 weeks after the injury. Full recovery and return to your sport is expected between 6 to 8 weeks. In the case of a grade III strain, which is severe, this means a complete tear of the muscle. Recovery from this type of injury is slower and often requires physical therapy or even surgery. Rehabilitation can take anywhere from 8 to 12 weeks or longer. In some cases, it may take 6 months or more before you can fully return to your sport. Rehabilitation progresses through different phases. Initially, you will focus on pain management and gentle mobility exercises. As you heal, you will gradually work on strengthening your hip flexors, glutes, and core muscles. This helps support hip stability and reduces the risk of re-injury. Later on, sport-specific drills like sprinting and agility work will be reintroduced to ensure you have the proper mechanics before returning to your sport. Athletic trainers and sports medicine professionals play a vital role in this process. They assess the severity of the injury, design personalized rehabilitation programs, and monitor your progress. Their goal is to help you return to play safely while balancing your eagerness to get back with the necessary healing time. It is important not to rush back too soon, as doing so can increase the risk of re-injury. Focus on strengthening the surrounding muscles, like your glutes and core, to help prevent future strains. Use a gradual, phased approach to rehabilitation that matches your healing stages. Keep a close eye on any pain or weakness. If you experience persistent issues, it may be time for further evaluation. To sum it up, returning to sport after a hip flexor strain can take anywhere from 1 to 3 weeks for mild strains, 6 to 8 weeks for moderate strains, and several months for severe strains. Athletic training careers involve guiding athletes through this recovery process, ensuring they follow evidence-based rehabilitation protocols tailored to their specific needs.